when I made a transition in my practice a few years ago, I wanted to spend more time talking about weight loss options instead of less. And we know that the only things the only risk factors that contribute to more death outside of obesity are high blood pressure. We know smoking, we know air pollution, outdoor and indoor, and we also know diabetes. So obesity is literally number 5 on that top list of causes of risk factors towards death. So we have to, we don't have the time not to talk about this. And so I've made it a priority in my practice. I know, Dr. Shah, let me just ask your opinion on that one. How do you approach this in a sensitive kind of way to make sure that we show empathy for our patients, but also telling them about the realities of the situation?
So a couple of different things, thinking about it from a patient perspective, because that was kind of the first thought I had, especially for someone coming in feeling like they don't want to be ashamed or shamed about their weight. One of the things I recommend is sending your healthcare provider a MyChart message or whatever message ahead of time. Just mentioning that you want to discuss weight, if you want to share a dietary log in there or what you've been doing on your own, or scheduling a special visit that's weight dedicated. I think that's one of the best ways that as a patient, you can advocate that you're going in with the preparation to talk to your healthcare provider about weight management. From a healthcare provider side, on the flip side, I think one of the best things that you can do is ask permission, because weight is a sensitive topic. We as healthcare providers, 100%, learn about it. We understand the science around it. We understand why treating it is important. But if we haven't lived in that body and we haven't necessarily experienced some of the stigma, around our weight and around our bodies, then it can be a very sensitive topic. And so I think, asking permission relays that olive branch that you understand that this is their body and you're there as, and honoring that for caring for them. And so I do think that, coming to obesity management as a provider and treating with your patients with respect versus this concept of a partnership with them versus, kind of more of the patriarchal approach to medicine is a great way to help people feel comfortable in trusting you with their healthcare around obesity management.